It's time for What's Hot. We talk about stories that have all of us talking.
We are joined by Susie Falk from the Falk Group Public Relations, and Jeff Wagner is back. So we are just about 2 weeks from when people can start applying for health care exchanges, but there is still a lot of confusion about what the Affordable Care Act does. Who's eligible, so many questions. A recent poll shows most people just don't understand it. Should the Affordable Health Care Act be repealed?
This is the classic definition of a train wreck. This is going to be an absolute and total disaster. It's going to be a disaster for people who are happy with their health insurance. I mean, just the other day, Walgreens told 180,000 employees, hey, we're not going to give you insurance anymore. We're going to give you some money. Go out in some of these exchanges, try to buy stuff. One of the big lies about this was when the president said, hey, if you're happy with your health insurance, you're going to be able to keep it. That's not the way this is playing out. Train wreck on so many levels.
It could be. I think we'll just slow down and try to figure things out. I think the Republicans have offered a plan just yesterday, the American Health Care Reform Act. And actually, I like many of the suggestions in it. And I think if we could modify what Obama has proposed and make it understandable so that employers can figure it out and they can articulate to their employees what's going on, and employees then will go figure things out, because quite frankly, nobody knows what's going on. I don't know the study you're referring to, but a Fortune published an Aflac study that showed something like 70% of employees don't know what's at stake here.
Well, that's the scary point. I think that some people don't know. I know when
we don't know what's going to happen to our health care.
Right.
I mean,
even here, when you have to fill out your health care, what are you going to do? It's a challenging thing. You really have to focus on it. You have to really understand it.
I think a lot of people now are we going to be able to afford health care in the next year? Personally, I think instead of drafting this huge plan, this huge act, we should have piecemealed it, because there's so much that needs to change about healthcare. So let's take one segment, make it work, and see how the other pieces fit.
Absolutely. See, everybody agrees there's issues. I mean, you have an issue with pre-existing illness. I mean, everybody, I think, would agree that, hey, you've paid health insurance for 20 years, you lose your job, you've got cancer, now all of a sudden you can't get insurance that's affordable. Everybody agrees that there's issues with that. The problem, though, is, I hate the cliche, but we really are throwing out the baby with the bathwater. Instead of dealing with these issues, we're completely revamping the system, and I think people are in for a lot of rude surprises.
Courtney, I really like the piecemeal idea, and there's a way of doing it, and I just wish there would have been a more thoughtful approach instead of a 2,400-page report, which
nobody's really
legislators
read.
are supposed to understand in a week. So I do have a problem with that.
I think there are going to be a lot of nightmares for people.
Not just the people, but the people who also have to run it, and the people who are going to be trying to deal with it. Everybody involved.
Which is why you keep delaying it and keep delaying it. At some point in time, you might want to say, hey, maybe what we got to do is maybe do what Warren Buffett says, go back and start over.
That's not going to happen.
I don't think,
That's a pride thing.
All right, coming up.
Our viewer's choice topic of the day.
Again, we're joined by Susie Falk and Jeff Wagner of 620 WTMJ. Well, the death of a middle school boy who had an allergic reaction to fire ants is fueling a debate over EpiPens in schools. The boy died about a week after a bill was introduced that would encourage states to require schools to stock EpiPens. Should EpiPens be available in schools?
Yes. I think so. I'm allergic to bees. I've had the need for an EpiPen. Kids have the need for an EpiPen. I don't see why they wouldn't have a couple EpiPens on hand in the nurse's office.
Because some kids have known allergies, like a peanut allergy. I found out bees early on, but it doesn't appear that this individual had been, stung or bitten by fire ants before, so he didn't know. And that would come in hand to have an EpiPen.
The trick is to get the permission, I think, to have the kids' parents
so you sign up, have all kids sign up permission.
Is you have to have as to how to use these. I mean, let's say, a lot of kids
you pop the cap and stab yourself.
Well, but it's more than just that, though. No, well, I mean, you want to talk about liability. It's more than that. I mean, you're going to have some degree of training. I mean, you're not advocating, having some teacher who's had no training, seeing this, grabbing one of these things and just sticking the kid, are you?
Well, no, but they're fake EpiPens. They're fake EpiPens out there that they can practice with. My sister-in-law is an allergist. She shows her patients how to do it with the fake ones that don't have a needle in it. It's just boom, boom, boom.
Yeah,
They're pretty
I mean,
easy.
it's like 2-second training.
I
it's
think
not.
well, and those nurses on staff
Right.
there at the schools can figure it out pretty easily.
Well, okay, but again, it's not just nurses at the school. I mean, it's going to be, if you're going to say that all the teachers are certified to do this, that's fine. But you're going to be in situations where, okay, this is at a football game or it's in a gym class or something. I'm not arguing against it. I'm just saying I think you have to think through how you're going to do this.
I don't know if it can actually hurt someone.
Yeah.
That's the thing. So if my child were having an allergic reaction and somebody didn't know what they were doing, hit them with an EpiPen and they lived.
If only our healthcare insurance question were as complex.
Yeah.
Time for our lightning round. Here's something to look forward to when going to the airport. Food trucks. You can grab a bite to eat in those airport cell phone lots, and some airports are going beyond the lots, offering food trucks in terminals. Do you think it's a good idea?
You know, at first blush, yes, I think it's a great idea, but I worry a little bit about security and the trucks and what you put in trucks and who's screening the trucks. But I think that if there's the demand for that kind of food and people are hungry, then why not if security is there?
Hey, if they're cheaper than the $10 sandwiches that I'm buying inside the airport, I'm all for it.
But see, that's what I really wonder. I don't know about you guys, but when I get to the airport, I mean, first, I'm not hanging around on the outside looking for something to eat. First thing I'm doing, grabbing my bags, getting through the security line, because you never know how long that's going to be. I mean, I just don't know what the demand is going to be.
Is it for the people that are waiting around?
It's for the people that are waiting around.
Or
And
then
the
in
cell
those
phone
lots.
Yeah, unfortunately, Milwaukee-Mitchell Airport's pretty easy to navigate, and I don't think we have cell phone lots. But for those busier airports and people who have to wait, you know, an hour, 2 hours for their folks to arrive.
Yeah,
why
I was
not?
at the cell phone lot at Chicago's O'Hare, and I thought it was in downtown Chicago.
Yeah.
It's so far away,
Right.
you know.
Then you're stuck there and you're starving.
Right, yeah,
and
yeah.
So food trucks, Cinnabons. Food trucks,
Food
Cinnabons.
trucks. I
you
figured
know?
out a new market. I think it's great.
As long as they keep the food trucks clean.
Clean, right.
Clean
so we don't
dining.
get dirty
Or else
dining
watch
out.
out.
I want
Courtney
manicures
Gerrish
in
is gonna
those
be looking.
lots, right?
Hey,
How about
Susie.
manicures, pedicures?
You are onto something.
Chair massages.
Get your
car
hair
washes.
did.
Right. All right, we're going to continue the What's Hot discussion online. You can find that page at tmj4.com/hot.